We have seen in part 2 of complement learning system the classical pathway, and now we will understand what will happen if some of the proteins are deficient. So if your early complement components are deficient, like C1, 2, 3, and 4, then you will end up with autoimmune diseases like systemic lupus erythematosus, your glomerulonephritis, collagen vascular diseases, and pyogenic infections. If your late components are deficient, like C5 to 9, then it leads to two specific infections like Neisseria. Neisseria, it is a gram-negative cocci, and there are two main pathogens in it: Neisseria meningitidis and Neisseria gonorrhoeae. Neisseria meningitidis usually causes meningococcal meningitis and septicemia. Toxoplasmosis, it is a parasitic infection, and it affects brain, muscle, and eye tissues. In Neisseria, the other pathogen is Neisseria gonorrhoeae, which causes gonorrhea, which is a urethritis. It is a sexually transmitted disease. So, if your late components are deficient, you end up with this bacterial and parasitic infection. The person will develop this infection. Uh, our body cannot let complement system unchecked, and that's why we have various checkpoints or various inhibitors to keep complement system in check. So one such check is C1s protein inhibitor. So C1s esterase inhibitor is there, and it checks its autocatalytic prolongation. So if this inhibitor itself is deficient, then what will happen, that complement system will go unchecked, and there will be inflammation everywhere, especially in mucosa, and that is the condition known as hereditary angioneurotic edema. The treatment is fresh frozen plasma replacement, as well as prevented by aminocaproic acid. So this is sometimes tested very frequently in various examination. It can also be tested in your short questions or in MCQ exam. There is another checkpoint at C3 level, C3 convertase level. There are two proteins, DAF and CD59, a decay accelerating factor, and it regulates the C3 convertase. If they are deficient, then the C3 convertase get dysregulated, complement pathway becomes activated and mainly affects RBCs, and this condition is known as paroxysmal nocturnal hematuria. We have a separate video made on this condition. You can check it out on our YouTube channel. So I'm not going into detail of PNH right now. Then S protein binds to C6 and 7 and keep it in check. So if it is also deficient, it can lead to diseases. How pathogen evade the complement system? So C4 binding protein, the pathogen captures C4, so pathway cannot move ahead. This anaphylatoxin inactivators, which binds to C3, C4, as well as C5a. There is a bacteria known as Pseudomonas aeruginosa, which releases elastase, and this elastase will also inactivate this anaphylatoxin and keep the actions of complement in check. As you can see, MAC complex is the main thing by which it exerts its action. So in gram negative, you have lipopolysaccharide and outer membrane proteins. In gram positive, you have peptidoglycan, and they does not allow this MAC complex to get inserted into their cell membrane, and that's how they evade the complement system. Some viruses like vaccinia, herpes simplex virus, Epstein-Barr virus, some parasites like Trypanosoma cruzi, some fungus, which is a yeast, basically yeast-like fungus, that is Candida albicans, and some other bacteria. They produce proteins which are very similar to complement, and they join a cascade somewhere here and there, and then the cascade abruptly stops, and that's how they evade the complement pathway. So these are the mechanisms by which bacteria or pathogens they evade the complement system. We also learned how, if complement components or their regulator, if they're deficient, what will happen, which diseases are there. So this is about classical pathway. In next video we will learn about lectin and alternative pathways, so stay tuned.